One.
Hi, I'm Carol Majewski. I'm the Associate Chief Quality Officer for Patient Experience at Dartmouth-Hitchcock, and I'll be your moderator for today's presentation. We're glad you've joined us for this first in our four-part COVID-19 recovery series called We're Here For You, We're Open, We're Safe, and We're Clean. We put this series together to answer some of the questions we've been hearing from our patients and community members about whether it's safe to come in for your regularly scheduled appointments or for emergent care while COVID-19 is still a part of our everyday lives. To respond to those concerns, we've put together a great panel to provide the information that you need to feel comfortable about seeing your doctors. By the way, if you have questions for our panelists, please send us a note at social@hitchcock.org. If we have time, we'll try to get the panelists to respond during the program, and if not, we'll post the answers to your questions on our website. So our panelists today are Dr. Pam Hofley. She's the Medical Director for Dartmouth-Hitchcock Manchester. We have Dr. Michael Calderwood, the Associate Chief Quality Officer. We have Ralph Jean-Marie, Vice President for Clinical Centers, who will speak about the Norris Cotton Cancer Center. And we have Keith Loud, our Physician-in-Chief for CHAD, the Children's Hospital at Dartmouth-Hitchcock. So thank you all for participating in our panel today.
Thank you for having us, Carol. Good to be here.
All right. So we're going to start with Dr. Calderwood. So Michael, as an infectious disease expert, can you share with our viewers a very high-level update about what's currently happening with COVID-19 infections around the country and specifically in New Hampshire and Vermont?
Of course, and thank you, Carol. I do think it's important to recognize some of the anxiety that people are feeling about COVID. The numbers are sobering. We're now approaching close to 12 million cases worldwide. 3 million of those have been here in the United States. And there are areas of the country where things are taking off. We're obviously hearing in the news about Florida, Arizona, California, and Texas that are seeing spikes in cases and difficulty finding enough hospital beds. So I do want to kind of highlight, I recognize that anxiety, but it is important to realize that different areas of the country have been experiencing this differently. Early on, we knew that New York City and Boston were hit very hard, but both of these areas are now showing improvement. And here in New England, overall, things have been improving. We've seen declining case counts and hospitalizations. Over the past week in New Hampshire, we've had an average of 20 new cases per day statewide. And this is encouraging and really speaks to the impact of social distancing. Obviously, I want to talk about that because I think we need to highlight the importance of that and the continued focus on that area.
So thanks, Mike. I mean, it's heartwarming to hear that we're improving, but I take it we're really not out of the woods. So what can people do to minimize their risk of infection and transmission as they go about their daily lives?
This is a question that comes up quite frequently. And when we think about the ability to halt the transmission of this virus, there are three things that I typically focus on. The first is the avoidance of large crowds. And people really have been changing a lot of what they do in terms of the usual large summer events. We've just gone through Memorial Day and 4th of July. These felt very different for people. And I want to highlight that that actually has made a huge difference in this state. We recognize that that was something that people really had to agree to not hold all their usual barbecues, not go to large 4th of July events. But it's been huge in terms of the safety and well-being of our state. The second is wearing a mask in public, particularly when you can't maintain a 6-foot distance from others. So if you're out in a grocery store, if you're out doing shopping, many stores are opening. We need to buy food. We need to get other things as we go about our daily lives. But that mask is both protecting you and increasingly more important in the recognition, it's protecting others. Some of us may be asymptomatic and not realizing we're at risk to transmit to others. Wearing that mask is a huge benefit to others in the community. And the final is good hand washing. So we're out, we're touching things in the community. Someone just asked me recently about their dog. the dog is not usually a risk, but on their fur, if they've been out at a dog park, out with a play date, they can have the virus. And so we want to be thinking about anything we might be touching and the ability to wash our hands. The other one I'll highlight is, I know a lot of people tend to touch their mask. The more we're washing our hands, the less we're going to contaminate that mask. And so it's really important both for thinking about the risk from eating, but also that mask you're going to wear multiple times through the day. Finally, I'll highlight that folks should stay home when they're not feeling well. We shouldn't be out and about. We shouldn't be going to work. If you aren't feeling well, reach out to your provider. There are a number of symptoms that may suggest COVID-19. We have plenty of testing available. We're in a much different spot than we were months ago. So I do really encourage folks to reach out, and we're encouraging broad testing to try and break this transmission.
Wow. Thanks, Mike. You've shared an awful lot of really critical points, but some key takeaways: avoiding crowds, wearing a mask, and washing your hands. Dr. Hofley, for a while, most health systems, including ours, shut down their elective and non-emergency procedures. Now, we've now resumed those procedures, but we know that people are concerned about their safety when coming in for appointments. Can you share with us what processes are in place in Manchester and across our system to keep people safe as they come in for treatment? And importantly, what can patients expect when they walk into our facilities?
Thanks, Carol. We are working really hard to partner with our patients and their families to keep everyone safe when visiting our facilities. When you come to any of our facilities, you'll be greeted at the entrance by one of our staff members. First thing, if you don't have a mask, we'll provide you with one that you'll wear throughout your visit here. Everyone on our staff and everyone entering our buildings wears a mask to protect each other. We'll make sure you're wearing it correctly, over your nose, under your chin. And we do have cloth masks available as well that you can take home and you can wash and reuse anytime you're in public, like Dr. Calderwood suggested. Feel free to ask the staff at the door and they can get you one. Next, you're going to be asked some screening questions to make sure you're not sick, and you will have your temperature taken. If you have any symptoms of coronavirus, you may be seen in another area of the facility. Then, once you enter the building, you're going to see big colorful dots on the floor and signs on the chairs we're using to keep everyone socially distant 6 feet apart. People have been telling me they look like the old game of Twister when we have people going over the dots in the front hall, which ironically is not a game about social distancing, but it's been fun. On another note, in order to help us keep the building from being crowded, we're limiting visitors to only caregivers needed for the visit. We may ask you to have your family or your friends wait outside or wait in the car. So once you're headed off to your appointment, you will notice our cleaning staff are out and about, even more visible than usual, keeping everything clean and sanitized for you. And of note, we have lots of hand sanitizer for you to use located at the entrances and all through the building, so use it generously. So Carol, we're masking, we're socially distancing, we're keeping everything clean for everybody. We know this works to keep us all healthy, but it's important to also know that if for any reason you don't feel comfortable or you can't come to an appointment in person, we're happy to arrange an appointment by video or by phone so you can still get the care that you need. Our providers have even come out to the car to see people in the parking lot. But I'm going to say, please keep in mind that although we'll make every effort to see you by telehealth if you want, we do need to see you in person for some conditions. We have yet to figure out how to set fractures or suture things over video. So we want to emphasize to everyone that you shouldn't delay getting the care you need to stay healthy. Some of you might have noticed the mark on my nose. I have a red mark on my nose, although it doesn't show that bad on video. It's much worse in person. I saw my dermatologist last week and he found a precancerous lesion on my nose that he froze off. I can hide it under my mask for most of the day until it heals. But I'm really glad I didn't wait longer, and because I might have needed a bigger procedure. Everyone in the office was really great to me. Since I obviously had to remove my mask to get care, the whole staff had face shields on to protect all of us. So it was a great experience, and I know that we can keep you safe here at Dartmouth-Hitchcock.
Great. Thank you, Pam, and I hope your nose heals quickly. But as you say, good move to get in there. So Pam, what are the risks to patients by not coming in for regularly scheduled procedures?
Well, it's really important for all of us not to delay taking care of our health, especially now. Effectively managing conditions like our high blood pressure or diabetes is more important than ever. We need to make sure we're immunized against those preventable diseases. We're going to have to be really careful about that in the fall with the flu season coming, and that we don't miss important cancer screenings. You shouldn't use this as an excuse to miss your mammogram or your colonoscopy, as tempting as that might be. I'm a gastroenterologist, going to plug that one in there. But it's tempting to just say, oh, I can't do it, I'm a little afraid. But you need to get in there, you need to have your cancer screenings so that we can prevent things. I mean, the thing on my nose is a little thing, a little skin cancer, but there's bigger ones, and we need to prevent it, and we need to keep you healthy. And with all the measures we're taking here, I feel very safe working here every day, and I felt very safe here as a patient, and I hope that everyone does.
Well, thank you, Pam. You make some great points, and I'm a little embarrassed to say I've been putting off a few of those screening tests myself, and I'm going to get on the phone and schedule them for myself. So Ralph, let's talk about COVID-19 has been particularly tough on people whose immune systems are fragile. What steps are we taking for those who are undergoing cancer treatments at the Cancer Center to keep people safe?
That's right, Carol. People who have cancer often have suppressed immune systems, which makes it much more difficult to fight off a virus like COVID-19. We ask our cancer patients and their family members to carefully follow steps to protect themselves, especially when it comes to hand washing and wearing a mask, as we just heard from Michael and Pam. In addition, a couple of days prior to the appointment in the clinic, patients are contacted by the staff to notify them of any special procedures they should follow when they check in for their appointment. During that phone call, the patient is also screened for possible exposure to COVID-19. Staff will ask questions about the symptoms they may have, about any recent travel, and whether the patient has been in contact with someone known or suspected of being infected with COVID-19. Now, within the clinics themselves, we have made modifications to promote social distancing and limit the number of people in the facilities at any given time. We've spaced out the time between appointments, and we've reduced the number of visitors allowed during the visit. Now, that said, we understand how important it is for our patients to have their loved ones be involved in their care, and we encourage that involvement. We welcome family members to participate in the clinic visit remotely using a phone or using a tablet. And as my colleagues mentioned, when appropriate, patients are also offered the option to connect with their provider via a video visit. When a patient enters a hospital or a clinic today, what they would see is that all the staff is wearing masks and that many are wearing face shields. And it is to protect themselves as well as protecting the patients. In addition, we also disinfect the surfaces in the cancer clinics multiple times a day, and also in between every single patient. And of course, if a patient has any concern at all about their risk for COVID-19 due to current or past cancer treatment, we encourage them to speak directly to their doctor or their nurse.
Wow. So Ralph, the Cancer Center had heightened safety measures in place to allow them to continue with treatments even before we resumed seeing patients in other clinical areas. Is that correct?
That's right. From the very beginning, Carol, we put in place strict safety measures, and we have followed the highest standards for infection prevention that our infectious disease experts like Dr. Calderwood have set for us. For example, early in March, as the pandemic was emerging, we quickly established social distancing by rearranging our check-in and waiting areas, the exam rooms, the infusion spaces, and the radiation oncology spaces. Very early on, we started screening patients for symptoms and taking their temperature when they came to the hospital. And by the way, we have the exact same protocol for the staff. So if I was to come into work with the slightest fever, I would be turned away and sent home to go see my provider. So it's no different for the rest of us who are in the building. We also limited the number of people who could enter the facility and asked our employees who could work remotely to stay home. And finally, we retrained our staff on new cleaning protocols. You know, we really had to act quickly because cancer patients just cannot delay their treatment, and they had to continue coming to the hospital.
Wow. You've shared a lot, and it's so important for that very vulnerable patient population. I want to take just a second to remind people to email your questions to social@hitchcock.org because we'd like to get to them. I'm now going to move on to Dr. Loud. Keith, at the beginning of the COVID-19 crisis, we heard a lot about how children aren't as susceptible to the virus, but lately we've been hearing that more young people are getting it. What can you tell our viewers, both parents and young adults, about the risk of them getting infected? And if they do start to feel ill, what steps should they take with their pediatricians or their family doctors to be seen or to be tested for COVID-19?
Yeah, Carol, the last part is the easy part, which is if you feel ill, call. I got to say on an earlier online video that we presented through this format, never worry alone. Please call. We can see you. So one of the exceptions to not leaving your house when you're sick that Dr. Calderwood said is when you're coming to see us. That's one of the reasons we're discussing this today. Or we could offer a house call to our video visit, which is a really nice opportunity to determine how important it is for you to see us in the clinic. But please call, never worry alone. I can continue to be reassuring that the worry about the novel coronavirus for young people is still low. We are certainly seeing more appropriate testing rates now that we have access to better testing, and therefore more young people, kids, and particularly young adults and older adolescents are contracting the virus, but are still seeing very mild disease. If anything, we've had only 9 admissions across the state of New Hampshire for children or people under the age of 20 into the hospital. My colleagues at other children's hospitals in the region confirm similar low rates of serious illness. So we are still seeing that as not the huge worry. I do worry, though, about things like influenza or other viruses like the measles. So it is important that we see children in the clinics in person to get their vaccines so that we can safely return them to school in the fall and other activities.
So Keith, one of the words that has resonated through this conversation has been the word mask. Pam has mentioned mask, Michael, Ralph, we've all talked about masks. But I know that sometimes young children or older children with special needs are not always able to wear masks for their protection or the protection of others. And what options are there for those patients to keep themselves safe and for those of us who are treating them safe?
Yeah, I get to reiterate some of the things that my friends have said already. There's a poster around the buildings you might see when you come in from the World Health Organization, a quote that says, "Let our shared humanity be the antidote to our shared threat." And masks are one of the ways that we demonstrate our shared humanity and protect one another. But there are folks, there are rare numbers of kids. So under 2, it's inappropriate to wear a mask and probably not necessary given their infection rate. And you mentioned older kids with developmental issues such as autism cannot tolerate a mask. There might even be others who have respiratory diseases for whom it's not safe to wear a mask. And those folks actually go into adulthood as well. So I think one of the things we can mention is, just as Ralph said, when you talk to your secretary or care provider prior to a visit, you can remind them of any of those conditions that you or your family member may have. We can certainly meet the patient, as Pam said, and get them into an exam room quickly. We can maintain the physical distancing. And then once in the exam rooms, you will see that the care team will wear face shields to provide that level of extra protection. Hand washing, of course, is also always important. So there are other means to make sure that those rare cases can be seen safely despite the inability to wear a mask. I think it's true, Michael, that we were really proud that so far, at least recently, no one in our system as a care provider who had appropriate protective equipment had transmitted the virus or had gotten the virus. And I think that speaks to how well our care teams can protect each other and ourselves.
And Keith, I think that's an important point. I would highlight the other side of that, which is to say we now are having increasing data that are out from areas that have had a lot more cases of COVID to suggest it's actually very rare for individuals in the healthcare environment to have transmission of COVID. So it's very rare for a patient to get COVID from another patient or to get from a staff member. So both in primary care, ambulatory clinic environments, and in inpatient settings, it is not a frequent occurrence. Most of the transmission is occurring in the community. So I do want to highlight that because I know folks are worried about coming into a healthcare environment, but everything that's been said here today is becoming a standard around the country and is really helping to prevent any risk to patients coming into our healthcare environment.
That's great to hear. So as we begin to wrap things up, I'd like to ask each of our panelists if you could share kind of one key point from your perspective that would be helpful to people who are concerned about coming in for appointments. What would that be? And I'll start with you, Mike.
So, I think the thing that I often highlight is that we have the ability to test for COVID, and the number of symptoms that have been linked to this disease continues to increase. If you are concerned that you might have the virus, speak with a healthcare professional, seek out testing. We no longer have the shortages on the testing side. At the same time, really a lot of what we're seeing is not COVID. And we have people coming in with all the other healthcare issues, illnesses that we've always had. And we're now seeing people come in very late in their illness because they were afraid to come in. And so we're having delays in care for things like heart attacks and strokes even. And this is really having a negative impact. And we want to focus on the fact that we can care for you safely, but we want to get you in early so you can get the best care possible.
Great. Pam.
Thanks, Carol. Well, I think so much has been said today, but I really want to stress what's on your graphic there. I mean, we're here for you. And if you're worried about it, call us. Let's talk about it. Let's work through this together. We can answer your questions if you've got more questions and make sure that we get you the care that you need. If you're not comfortable coming in, we'll work with you on the phone, by video, and we'll meet you where you are, but please don't delay care, because as Mike said, we're seeing more and more people coming late in the game, and we don't want that. We want to keep you out of the hospital, and we want to keep you well, and it's safe here in the clinics.
Great, thank you, Pam. Ralph.
Thanks, Carol. One thing I'd like those watching to know is that all of us on this panel have continued coming to the hospital over the last 4 months. And we've been here all along from the very beginning of this pandemic. For myself, with a wife and 2 young children at home, as well as some older relatives at high risk for contracting the virus, my safety and their safety is of genuine concern. So the last thing I would want is to infect a family member or to become sick myself. Frankly, of all the places I could go in the community, I feel safest in the hospital because of how seriously we've taken this disease and the responsibility we have to ensure that employees and patients alike are safe. So our practices and protocols may have changed in response to COVID-19, but I can assure everyone that our commitment to providing the safest patient care has not.
Thank you. I agree. I've been here every day as well. And truly, I feel safer here than I do in the grocery stores and the other places I need to go on a day-to-day basis.
There is no doubt about that. I always feel safe when I'm here. And I felt safe bringing my family members. I've had convinced my brother to come in for different treatments and taken my mom in. And it's, this is a safe place.
Very much so. Dr. Loud.
Grocery store.
I think that's because these aren't completely novel policies or protocols for us. So I'm particularly proud that Pam and Ralph, in addition to their other roles, have leadership roles in CHAD. And, we know about respiratory viral illness, and every year we need to take extra precautions around flu season, but we are good about separating people and keeping distances. Kids are vulnerable, and kids with cancer, and also older folks with cancer. So like that farmer's commercial, we know a thing or two because we've seen a thing or two, and we're doing what we know how to do on a higher level, more rigorous, but you can feel comfortable that we know how to do what we're doing.
Awesome. Great points. So I want to thank each of you for an incredibly informative, but also very reassuring conversation today. I'd also like to thank the viewers who have sent us questions. If we didn't get to your question, please check back to our DH.org site for answers, as we will respond to them. Also, I want to invite you to join us next Wednesday as we talk about clinical care changes at DHH member hospitals. And we're going to speak with leaders and providers from Cheshire Medical Center, New London Hospital, our visiting nurse for Vermont, and Alice Peck Day Memorial Hospital. So thank you again for joining us.
Thanks, everyone.
Thank you.
Thanks, everyone.